Hi, hello, namaste. Welcome to our channel MBBS Study. This is going to be our second class that is about the anatomical terminology. The basic terminology of anatomy which you should know before entering into the right concepts of anatomy. By this you can build some basic futures so that you can level up your concepts. So coming to as I said, I will start my class with the orientation. The orientation of this class is going to be anatomical positions, anatomical planes and anatomical terms. These are the three topics that we are going to discuss in this class of anatomical terminology: positions, planes and terms. First, coming to anatomical positions, there are seven anatomical positions: supine position, prone position, lithotomy position, right and left lateral recumbent position, Trendelberg position, Fowler's position and Sims position. These are the seven positions. Next, anatomical planes: median or mid-sagittal plane, sagittal plane, coronal or frontal plane, transverse or horizontal planes, oblique plane and cardinal plane. Next, coming to anatomical terms, the descriptive terms, terms which are related to the upper limb, terms related to the embryonic development, terms related to the movements, terms related to the vessels and terms which are important for the clinical anatomy. We will see everything in this lesson, in this chapter and in this class. Okay, coming to first thing, that is anatomical positions. In this anatomical positions, the first position is the supine position. I will say you a trick how to remember the supine position. Supine, up. We are going to see up. When we are super, we will always see up. Our head will be facing upwards and we always see upwards. See, so in that manner, the trick for the supine position is upper, seeing upper side. So the head will be facing upward, palms facing upward, all upward it's going to face. Feet put together, arms by the side and lying on the back. We are going to lie on the back. We're coming to the prone position. We are going to lie on the belly. Supine position, we are going to lie on the back and our head will be facing upward. Just you need to remember, just if you are going to identify these positions, if you know these positions in your mind, it's well and good. You no need to remember all these terms. Just remember it's facing upward. The back lying on the back, here lying on the belly. Belly is going to face downward, lying on the belly. Okay, supine position, prone position. I said a trick, that is supine means super. When we are super, we will always, our head will be facing upward, our eyes will be seeing upward. So remember in that manner. Next, lithotomy position. Lithotomy position is person lies on the back, same as the supine position. This back will be lying on the back. Person lies on the back, legs and feet supported on the stirrups. These are the stirrups. Here the legs and the feet are supported on these stirrups and hips and knees are semi-flexed. These are semi-flexed hips and knees. Here hip is semi-flexed and knee is also semi-flexed and thighs are abducted. Remember this one. And the main position for lithotomy position, where you will find when you are going to your surgery or obs and gynec postings, that are delivery of the baby and surgeries. This is the main use. You will find there the lithotomy position. And when coming to right and left recumbent position, left lateral recumbent position, yeah, the person is going to lie horizontally and face towards the left side. Here the person lies horizontally, one side of the person lies horizontally and it will be facing towards the right side. Where these positions are used, left and right lateral recumbent positions are used in the case of when the person is going to have the seizures. We are going to make the person to immediately come into the left and right lateral recumbent positions. These are very helpful in those situations. Next, coming to the Trendelberg sign. In Trendelberg sign, you have to just remember that feet are higher as compared to the head. How to remember this one? Trendelberg sign, leg, Trendelberg, leg. Remember this one, leg. Legs are high. Feet are higher than head by how much degrees? 15 to 30 degrees. Okay, next coming to Fowler's position. Most commonly where you are going to see this Fowler's position is sitting straight up and leaning straight backward. It is for improving the breathing in non-ambulatory patients. The patients for improving the breathing, we are going to make the persons sit in the Fowler's position. If they are in this manner, the respiratory muscles will be compressed. So we are allowing the person to come to the Fowler's position so that the person is able to breathe slowly. Okay, That's next. Coming to Sims position, person lies on his or her left side and right hip and right knee are flexed. Which side are flexed? Semi flexed. Right side are semi flexed. Right side hip and knee are semi flexed, whereas the lower lip and lower limb are straight. You can see these are straight. These are used for rectal examination. Where these are used? Rectal examination. So now I have said in the first class, I have said that my lectures will be having the active revision technique. These are this, and I also said there will be handmade diagrams. These are the handmade diagrams that I prepared for these positions. Let us write every position here. What is this position? This position is going to be the supine position. Why? Because he is facing upward. The face is upward. Super. When we are super, we face upward. Whereas I also said another word, that is our back is going to lie. Our back is lying on the bed. Okay. Here in the next one is the prone position. Opposite to spine position is the prone position. Just remember that one. Our belly is going to lie on the bed. Next, coming to this one is the lithotomy position. Lithotomy position. What I said here, super. Our head is going to face upward. Lithotomy position. In the lithotomy position, what is going to happen? Where we are going to use lithotomy position? In the case of babies, in the case of parturition, as well as in the case of another thing, that is for surgeries. I said we are going to see in the obs and gynec postings. Next, this one is right and left lateral recumbent positions. Okay. Right and left lateral recumbent positions. Next, coming to this, feet are higher, legs are higher. That means it is Trendelenburg position. Trendelenburg. How I said to remember? Leg. Trendelenburg. Next, coming to this one is the Fowler's position. Fowler's position is for the non-ambulatory patients in order to take the respiration in the case of the non-ambulatory patients. Next, coming to this position, what is this one? We are going to turn onto the one side. Our right side are semi-flexed hip and knee, whereas the left side are straight. This one is called as Sims position. This is the active recall technique that I said. Supine position, prone position, lithotomy position, left and right lateral recumbent position, Trendelenburg position, and next Fowler's and Sims position. Okay. Next, coming on to the anatomical planes. Till now, what I have discussed anatomical positions. The first orientation of the first topic is completed. That is supine position, prone, lithotomy, left and right lateral, recumbent, and Trendelenburg, Fowler's, and Sims position are completed. Now, next we are going to enter into the anatomical planes. These are very, very important. When you are going to you do the dissection in the dissection hall, these terms plays a crucial role there. Come on to the anatomical planes. In anatomical planes, median or mid-sagittal plane, understand this one. Median or mid-sagittal plane is the one that is passing through this and which is going to divide our body into right and left equal halves. This is the right equal half and other side is the left. If median or mid-sagittal, you just are going to remember right and left equal planes. Median means always from the midline. Okay, right and left. Remember this one for this one. Mid-sagittal plane, that is right and left. When coming to coronal or the frontal plane, body divides into anterior and posterior. Okay, anterior and posterior. Just remember this one so you can. This is the anterior and back one is the posterior. Next, coming to transverse or horizontal plane. Remember the word up and down, upper and lower positions. This is the upper position and this one is the lower position. Okay. Next, coming to the here I'll show you that one. This is the mid-sagittal plane, which is going to divide our body into right and left. When coming to the coronal plane, into anterior and posterior. When coming to transverse or the horizontal plane, into up and down. That's it. Next, what are the other two things? What are these? Sagittal plane. Sagittal plane means any plane which is going to pass parallel to the mid-sagittal plane is the sagittal plane. If the plane other than, what is oblique plane? Oblique plane means other than all the above planes. That is the median, mid-sagittal plane, coronal plane, transverse or horizontal plane or the sagittal plane. Other than all this, it is going to be the oblique plane. That's it. Now, we are going to see our handmade diagram, how it is going to help. I'll show you. median or mid-sagittal plane, which divides our body into the right and the left. When coming to transverse or horizontal plane, into up and down. And when coming to frontal or coronal plane, anterior and a posterior. And next, coming to sagittal plane, is the plane that is parallel to the median or the mid-sagittal plane. Okay, when our body is divided and cut at this manner here, so this is the cross section that we are going to observe. Understand? There are 5 planes. First one is the median or the mid-sagittal plane, which is going to divide our body into. First one is the median or mid-sagittal plane, which divides our body into right and left. And second plane is the transverse or horizontal plane, which divides our body into up and down. And next one is the coronal plane, or it is also called as the frontal plane, which divides our body into anterior and posterior. And next, coming to fourth one, that is the sagittal plane. Any plane which is parallel to the mid sagittal plane is called as the sagittal plane. And third one is oblique plane. Any plane that you are going to cut other than all the 4 above is going to come under the oblique plane. That's it. We have also completed the anatomical planes. Till now I have discussed anatomical positions, anatomical planes. Once again I'm going to revise these both things by the active recall technique. Okay, come on. First one is the supine position. Next one is the prone position, lithotomy position, right and left lateral recumbent position, Trendelenburg position, Fowler's and Sims. Okay, where we are going to use lithotomy is used in the surgery and for the parturition. In the right and left lateral recumbent positions, in the person when they get the seizures, we are going to immediately turn the person into right or left lateral recumbent position. Mostly left is preferred. Next, Trendelenburg sign, the feet are going to face upwards than the head by 15 to 30 degrees. Next, coming to Fowler's sign for taking the respiration in the case of non-ambulatory patients. And the Sims sign we are going to use in the case of rectal examination. Next, coming to anatomical planes, there are 5 planes. One is the median or mid-sagittal plane, dividing into right or body into right and left, and transverse or the horizontal plane into up and down. When coming to the frontal or the coronal plane, into anterior and posterior. When coming to sagittal plane, is the plane which is said to be parallel to the median or mid-sagittal plane. Any plane that passes parallel to the median or mid-sagittal plane is a sagittal plane. Oblique plane is anything other than these planes are said to be our oblique plane. Okay, that's it. We have discussed the anatomical positions, anatomical planes. Now coming to anatomical terms, the descriptive terms. What are the descriptive terms? These are very, very important. You are frequently going to get whatever you read, upper limb, lower limb, thorax, abdomen, pelvis, or head and neck, whatever the chapter you read in anatomy, you are going to get this, and it will also be helpful in the case of the surgery. So you need to know the anatomical terms. What are there are 5 topics under this anatomical terms. First one is descriptive terms. Anterior, posterior. These both are one. Superior, inferior. Medial, lateral and median. These 3 are one. Superficial, deep. Central, peripheral. External, internal. Ipsilateral, contralateral. Invagination and exvagination. Coming to this one. First, superior, inferior. Okay, understand, I always said that superior means you have to remember super. When we are super means we are going to be in the upstairs or the up super up. We are going to be up, that is the cranial side. Cranial, here the brain is located, no, cranial. Okay, when coming to inferior is the caudal. How to remember caudal as inferior is the coccyx. You remember here the last bone is the coccyx, right? So by the coccyx, C for coccyx, C for caudal. Remember like that. Inferior caudal, superior cranial. Next, I will say the proximal and distal. These are the 2 words. Distal, you remember the word distal by the end. D for distal, D for end. The end one is the distal. Okay. When coming to proximal means near one is the proximal. Okay. This is the near one, that is the proximal. This is the end one, so this is the distal. Okay. Next, coming to anterior and posterior. This is anterior, this is posterior. How to remember this is anterior? Where our head will be, eyes will be facing, that is anterior. And where our hair will be facing, that is the posterior. Remember in this manner. Okay. Posterior means hair, whereas anterior means eyes. Anterior is eyes. Next, coming to dorsum, foot and plantar surface. Dorsum of the foot, plantar surface. Plantar surface, you remember the sole of the foot. Sole of the foot, down one is the, we are going to step on the plant. I am stepping on the plant. So this will be my plantar surface. Remember in this manner. Whereas the dorsum surface, the other one will be the dorsum. You don't need to remember like that. Okay, that one. The plantar surface means I have said that plant, on plant I'm walking, so this will be my plantar surface, and upper one will be my dorsum surface. Anterior, where the eyes are present, that is anterior, eye, anterior, whereas the posterior one is where my head is present. Okay, hair is present, that is posterior. Next, coming to superior means super, super means we are going to be up. Inferior, in, down, where the caudal end, that is coccyx I have said to remember. And here the cranial brain is present, up. Okay, next proximal means near, distal means end for D for distal. Okay, next coming to the another three, that is medial, median and lateral. First remember, lateral means, medial means towards the midline. Okay, lateral means away from the midline. Okay, M for medial, M for towards the midline. These are matching, so there will be friends, so there will be near. Remember like this. When coming to median means intermediate. Intermediate means median, intermediate. That is in between A and C points. It is going to be present. That is, it is median to A and C. We are going to say. When coming to medial border means what I have said, which is near to the midline. This is near to the midline, so it is a medial border, and this is a lateral border, which is away from the midline. M for medial, M for midline. These both are near, these both are friends. The towards the midline is the medial, and away from the midline is the lateral. Superior medial, it is up and towards the medial side. So superior medial, and this one is down, it is down and towards the, away from the midline, so it is lateral, inferolateral. Just divide the words, superior, medial, inferolateral. That's it. Next, superficial and deep. Always remember, superficial means surface. Surface which is present on the surface is the superficial. Okay, deep means deep inside. You know this general words. Coming to exterior and interior, this is exterior. Outside one is the exterior. Out, exit, out. Interior, coming to inside, inside is the interior. Invagination, inside, invagination. Evagination, exit. Wherever you get the word evagination, exterior, you remember the word just exit. It is going to come out. Evagination. Okay, we have completed this one. I'll revise it through my handmade diagram. That is, this is the superior or the cranial. I have said this one superior. When we are super, it will be up. Okay, inferior or caudal, I said coccyx. Coccyx will be end, so it is caudal. C for coccyx, C for caudal. Here cranial, I have said that the brain is here, so it is cranial. Inferior, in, downwards. Next, coming to distal. Distal, end one is the distal. Proximal means the near one is the proximal. Remember, just the end one is the distal. Opposite thing, you can remember, proximal is the near one. Next, coming to anterior and posterior. I have said which side is the eyes, that is the anterior. Which side is the hair, that is the posterior. When coming to dorsum and dorsum of the foot and the plantar surface. Plant, I am going to walk on the plant, so this is the plantar surface, and opposite one will be the dorsum. Okay. Next, invagination, exvagination. This is the invagination and this is the exvagination. Okay, inside is the invagination, exvagination is exterior. I have forgotten to draw that. Outer, exterior, external, and this one is the internal. Okay. Next, coming to terms which are related to the limbs. Proximal, distal, palmar, dorsal. I will explain you this one. First, I have already said that the proximal means near, distal means end, D for distal, D for end. Okay, distal means end. This is the end, so this one is called as the distal, and this is the near one, near to the body, so it is proximal. Next, coming to medial and lateral border. What I have said, if this is the midline of the body, which is near to the midline, is the medial border. Medial border is the ulnar border. Lateral border is the radial border. How to remember? Lateral is the radial. Remember, by one trick, lateral R are coming, so radial. Okay, remember in this one, in this way. Next, flexor surface, extensor surface. How to remember this one? Extensor surface, flexor surface. You can remember this when I say you the movements, that is the flexion and extension. In that way you can remember this one. Okay. Tibial and fibular is nothing but when you draw the foot. When you draw the foot, this one is the tibia, this one is the fibula. So this one is the tibial surface and this one is the fibular surface. Okay. Same as how we said, here is the ulnar border, this is the radial border, same manner. Next, coming to the embryonic terms, which it is important to study in the embryology. When you get to the embryology, it is very important to see. First one is caudal. I have already said coccyx, caudal. Okay, end side. When coming to cranial or rostral, here the brain is present, cranial, and the rostral. Next, coming to ventral and dorsal, dorsal. How to remember dorsal is the back side. That is the back side, there is a door, that is the dorsal. Okay, my secret is there is a back side, there is a door, that is dorsal door. Okay, ventral means ventral. Okay, opposite one you have to remember. I will say only trick to one thing, so that opposite one you can remember. Next, coming to the movements, these are very important. When you are reading the joints, this will be coming so frequently, so focus on this. This is flexion. Always I say that flexion means less angle, extension means more angle. Okay, between, this is the hand. When you are doing like this, there is a less angle in between, so this is the flexion. Okay, when you are going to do like this, hand from here to, I have brought this hand to here, so this one will be my extension, the angle is more. Okay, did you understand? Remember just this one, flexion, flexion, less, L for less. Okay, extension, opposite one I have said already one, so opposite one will be the reverse, more angle. Okay, less angle, more angle, flexion for less angle. In coming to abduction, adduction, how to remember? When you keep your hands far away from your body, like this. If you keep your hands not like this, if you keep your hands like this, what is going? Abba, my hands are paining. Abba, abduction. Okay, this one will opposite one, adduction. That's it to remember. If you keep your hands more time like this, it is going to pain, so you will say abba, my hands are paining, so it will be abduction. So when you keep near, adduction, opposite one. Okay, the order of these all doing in a sequence is called as circumduction. Okay, next, medial rotation, lateral rotation. If you have understood the word medial and lateral, medial means towards the body, so this will be my medial rotation. And when coming to lateral means which is away from the body, from this position you have brought to this position, so this is lateral, away from the midline, so it will be lateral rotation. I will show you in the diagrams now. How to remember supination and pronation. Coming to, I only say one word. There I have said super means you have to look upward, but here just related to the hands, there is no eyes. No, there I have said super means our eyes will be upward, we will be confident, we're looking upwards. But here there is another technique. You have to remember pronation. Pronation means promise. How they do the promise? In this manner they do the promise. Promise will be done in this manner. So this will be the pronation. Promise, pronation. The opposite one will be the supination. That's it. Okay. Next, inversion, eversion. In means towards, inside. I will show you the diagrams. X means outward. Remember this up to that. Elevation upwards, depression down, protraction, retraction. I will show you everything in the diagrams. First, coming to flexion and extension, abduction and adduction of the the lower limb. Okay, this is the flexion. I have said there is first lower limb and upper limb both. This is the flexion. Okay, there is a less angle. When coming to extension, there is a more angle. Flexion, less angle. Remember just this one, less. It is going to stay with you forever. Flexion, less angle. Extension will be opposite, more angle. Where this is going to happen, flexion and extension of the upper limb is going to happen at the elbow joint. Next, coming to flexion and extension of the lower limb. Here, less angle is the flexion, more angle is the extension. Okay, just to remember that one, you can, the concept will stay with you. Concept will stay with you forever. The flexion and extension of the lower limb is going to occur at the knee joint. Okay. Next, coming to the dorsiflexion and plantar flexion. Already I have said that flexion means less angle. This one is dorsum of the foot, so dorsiflexion. When coming to extension, plantar flexion. Plantar, I have said that this is the plantar surface. Why? Because this surface is touching the plants when we are walking. So this is the plantar surface. Not the reason that is, but we are going to remember in that manner. This is the plantar flexion. Okay, the angle is going to increase, but both it is called as the flexion only. Remember this one. This is an exception. This one is going to occur at the ankle joint. Next, coming to abduction, adduction. This one is the where this is the normal hand. We are going to bring our hand to this manner. Our hand is, if you keep in this manner for a long time, our hand is going to pain. So we say, Abba, my hand is paining. So it is abduction. When we keep hands in this manner, our hands is not going to pain. So adduction. Okay. Lateral rotation, medial rotation. This is the midline. So we are bringing our hand towards the midline. So this is the medial rotation. Our friends, I have said this one. And if we bring our hands away from the midline, this one will be our lateral rotation. If we do flexion, extension, abduction and adduction in an order, then it is said to be as circumduction. Okay. Next, I have already explained supination, pronation. Supination, pronation means promise. The position of the promise will be the pronation, and the opposite will be supination. Inversion, eversion. See, this is the midline of our body. These are the two legs you think. Okay, this is another leg that I have drawn. If we are going to bring our position of the foot towards the midline, that is inside towards the midline, that is inversion. Up to 30 degrees it can be done. Coming to eversion, up to 20 degrees only it can be done. That is away from, exit. We are going to exit from the midline. That is eversion. Okay. Next, fingers. How the fingers abduction, adduction. If we keep our fingers for more time at the far apart, we'll say, Abba, my fingers are paining. So it will be abduction. If we keep our fingers near, nothing is going to happen. So it will be adduction. Opposite you have to study. If we keep our hands far for so much time, fingers for so much time, it is going to, you say, Abba, my legs, my fingers, my toes are paining. So it will be abduction. When we keep near, nothing is going to happen. So this will be adduction. Next, coming to we have already shown this diagram. Next, coming to this one of the thumb, our hand fingers. How we are going to say, this is the neutral position, normal position of the hand. Flexion means, I have already said there should be a less angle. If there is a more angle, that is extension. Abduction, adduction. If we keep far away from this, if we keep perpendicular, see what is the difference is, here we are keeping perpendicular, here just we are folding. Okay, perpendicular to the plane. Here it is abduction, my hands are paining. When coming to here, it is adduction, opposite one. Okay, remember this one. Neutral position and adduction are not same. Neutral position, there is a little angle between the normal position, but adduction is bringing the thumb close towards the index finger. Next, coming to opposition, we are using the thumb for opposite fingers. These fingers we are counting. When opposition, you just remember counting. Okay, these positions are just, you need to keep in mind. When they say that position, it should be click in your mind, so that you can understand the concepts. That's the need of these positions. You doesn't need to like draw the diagrams or anything in this. Just you need to have the picture of that position in your mind. That's it. Next, coming to vessels. The terms I have said, no anatomical terms. In that we are coming to the vessels. Artery. Artery is the one which is carrying the blood away from the heart, and vein is the one which is carrying blood towards the heart. Arteries always carry oxygenated blood. Veins always carry deoxygenated blood. Arteries, all the arteries carry oxygenated blood except the pulmonary artery, and all the veins carry deoxygenated blood except the pulmonary vein. Coming to capillaries are the smallest microscopic network of the vessels. Smallest microscopic vessels which form the network are going to be called as the capillaries. These are the smallest and finest vessels. Next, coming to anastomosis is the communication between the adjacent vessels is the anastomosis. Okay. Next, coming to clinical anatomy terms, itis. Already we know itis means inflammation. Appendicitis means appendicitis means inflammation of the appendix. Ectomy means removal of the part from the body, that is appendectomy. Hysterectomy, we say removal of the uterus from the body is hysterectomy. Coming to otomy means opening and closing the hollow organ. Hollow organ will be opened and it will be closed. Hysterectomy. For doing any surgeries, we are going to open and we are not going to remain it open for a long time. If it is remained open for a long time, it is kept open like that only. Ostomy. Okay, remember this one. Close is not there. So here S, we are going to put S. So it is ostomy. Ostomy means open hollow organ and leave it open. That is cystotomy. In the urinary bladder, we are going to keep the hole, open it, and we are keeping the hole open and keep the hole, and we are going to leave it. Then coming to oma, tumor. It is the tumor of any tumor. We are going to represent it with a suffix oma. Osteoma means tumor of the bone is called as osteoma. Finally, we have completed this one. Once I will revise this terms which are related to the anatomical terms. I will discuss the anatomical terms. The third topic, it's completed, but I'll once again revise it. This is the superior. This is the superior. Superior, I have said there is a brain, so it is a cranial, and inferior, which is caudal, means I have said coccyx is present here. So because of the coccyx bone, not because of the coccyx bone, it's all my techniques what I'm saying here. It's not the reason that I'm saying. Okay, coccyx, C for coccyx, C for caudal. Distal, D for distal, D for end one is the distal. And coming to proximal is the near one. This is the anterior, this is the posterior. Anterior means eyes, which are present on the eye side is the anterior, where the hair is present is the posterior. And coming to plantar surface of the foot, I have said that this surface is going to step on the plant, so it is the plantar surface, and opposite one will be the dorsum of the foot. And here the median means which is nearer to the midline is the medial. M for midline, M for medial. These both are French, so they'll be close together. Midline, which is far away from the midline, will be the lateral. And between the two organs, if in between the two structures, if it is present, we say it is medial or intermediate. Coming to superior medial, which is up. Divide the two words, superior, up, as well as medial, towards the midline. And this one is inferolateral, means down, and it is lateral, means away from the midline. That's it. Invagination, exvagination, you already know. Invagination towards into, evagination means outside, exit. Next, coming to terms which are related to the limbs. This one is the flexor surface. Just now I have said this. If there is a less angle, that is the flexion, right? So this one will be my flexor surface, and this opposite one will be my extensor surface. Okay. Did you understand? If this is my hand, if I keep like this, this is the flexor surface, this is the extensor surface. Palmar surface means this is the palm, right? So this will be the palmar surface and the dorsal surface. That's it. Lateral border, I have already said that towards radial. This is the there will be a radius bone on the lateral side. So this is the radial border. This is the ulnar bone will be on this side, so it is the ulnar border, same as the tibia and fibula. If you take the leg, this is the medial, this is the lateral, tibia, fibula, tibular surface, fibular surface. Okay, this is the proximal, distal end one. Okay. Embryonic terms, when coming to embryonic terms, ventral, dorsal, cranial, and caudal. Ventral, I have already said dorsal. This is my secret. Backside there is a door, so dorsal is the backside. Remember this one like this. When coming to caudal, I have said that coccyx. is here, the last bone, sacrum, coccyx, so caudal. Then next cranial, here the cranial brain is present, so it is the cranial and or called as the rostral. Next coming to movements, flexion, extension, flexion, less angle, extension, more angle. Next, if we are going to place our hands far somewhere that will be far from our body is the abduction. The more pain is going to come, abba, there is a more pain in my hand, that is abduction. And opposite one will be the adduction. Medial rotation means towards the midline. If we move our hands towards the midline, or if we move our legs towards the midline. Lateral rotation means away from the midline. Circumduction, if all these are done in an order, that is called as a circumduction. Supination, pronation. How to remember? Pronation means promise. How we are going to give the Rajamata Agnya, she is going to view, that is the promise, that is the pronation. And opposite one will be the supination. Inversion, eversion, into and out. Remember this one. Elevation, depression, I have not said, I'll say now. See, if we are going to lift our shoulders like this one is going to be elevation. When we are going to keep our shoulders down, that will be the depression. Or another most they say is that the jaw, mandible. The mandible, if it is open, if we opened our mouth, okay, if we open our mouth like this, our mandible is said to be depressed, so it is depression. If we are going to close, while closing our mouth, our mandible is elevated, so it is elevation. That's it. When coming to protraction and retraction, if the mandible, if the lower jaw is thrown outward, it is protraction. When it is moved into inward, then it will be retraction. That's it. Next coming to the, this is the flexion. I have said there is a less angle and extension, more angle, flexion, less angle, extension, more angle. And here there is an opposite, there is an exception, that is this is also called flexion, this is also called flexion, dorsiflexion, and this is the plantar flexion. This you remember, plantar. I am going to walk on the plant, that is the plantar. Okay, completed. Next coming to abduction. I have kept my hands far from the midline, my hands are pointing above, my hands are pointing abduction. Lateral rotation, medial rotation. Okay, next I have already discussed this also. Next coming to the terms related to the vessels, that is the arteries. Arteries which is going to move the blood away from the heart, and veins are going to move the blood towards the heart. Next coming to capillaries, are the smallest microscopic vessels which are going to form a network, are the capillaries. Anastomosis means communication between the adjacent vessels, is the anastomosis. When coming to clinical anatomy, itis means inflammation. Ectomy means removal of the body. Otomy means open and close the hollow organ. When coming to ostomy, here closing is not present, S is not present, so S is present here, so I will not do S here, so closing is absent. Open hollow organ and leave it open. Oma means tumor. I have finally completed the anatomical positions, anatomical planes, anatomical terms. My class is completed. Now there is an active recall session. Come on. What is this position called? First we'll discuss anatomical positions. What is this position is called? Supine position. What is this position? Prone. What is this? Lithotomy. Where it is used? In the case of parturition and in the case of the surgeries. And this one is the left and right lateral recumbent positions. Okay. Next one, this one is going to be my Trendelberg position. Legs are upwards. Trendel, legs are upwards. By how much? 15 to 30 degrees. This one is for respiration in the case of the non-ambulatory patients. This is called as the Fowler's position. And this one is going to be my Sims position. Whereas the right leg and right hip are semi-flexed. Whereas the right hip and right knee are semi-flexed. When coming to left are straight. Okay. Next, we have discussed about the anatomical position. Supine, prone, lithotomy, right and left lateral recumbent, Trendelberg, Fowler's and Sims position. Coming to anatomical planes are median or the mid-sagittal plane is going to pass through the midline, is the median or the mid-sagittal plane, which is going to divide our body into right and the left halves. When coming to frontal or the coronal plane, which divides our body into anterior and the posterior. Transverse plane divides our body into up and down. And when coming to sagittal plane, which is the plane which passes parallel to the median or the mid, any plane which passes parallel to the median or the mid-sagittal plane is called as a sagittal plane. Whereas the oblique plane is nothing but the any planes other than these four are called as the oblique plane. I have also discussed the planes, that is the median mid-sagittal plane, coronal plane, transverse, horizontal, as well as the oblique plane. Next, coming to anatomical terms, descriptive terms. One is the superior or the cranial. Super means upwards, and inferior downwards. Caudal, I have said that coccyx, inferior in downwards. Coccyx is present down. C for coccyx, C for this one. And distal means end. Okay. Proximal means near. Next, coming to median, which is towards the midline, and lateral is away from the midline. Median means in between the two structures. If it is present, it is called as the median or intermediate. And superior medial, I have said to divide the words. Inferior lateral, divide the words. Next, coming to anterior, eye is present anterior, hair is present posterior. Just these are the words that I said to remember. I said like a tricks, but these are not the reasons why they are called for. Okay. And the plantar surface, where we are going to walk on the plant, that is the plantar surface, and this is the dorsum. Invagination, and this will be the exvagination. And the flexor surface, extensor surface, lateral, there is here the radius is present on the lateral side, that is the radial border, and this one ulnar bone is present on the medial side, this one will be the ulnar border. This is the proximal, and this one is the distal means I said end, these are the ends. Okay. Palmar means this is the palm side, this is the palm, and opposite will be the dorsal. And these are embryological terms. This is the cranial, this is the caudal. Cranial, I have said there is a brain, and caudal, I have said there is a coccyx. Okay. Down, ventral and dorsal, I have said one secret, there is a secret door behind this, there is a secret door backside. So door back, dorsal is present backside. Next, coming to flexion, extension, abduction, adduction. Flexion, I have said that less angle, extension more angle, abduction if it is far from the body, so my hands are going to pain, that is above my hands are paining. Abduction, opposite will be the adduction. Lateral rotation, it is away from the, rotating the hand away from the midline, or rotating the leg away from the midline and rotating towards the midline. If these are done in the order, that will be the circumduction. Supination, pronation, I have said already said that a promise, that is the Rajamata is going to do is our pronation, and the opposite will be supination. Inversion, aversion, this is the midline, my foot, this is the inversion towards the midline, this is the aversion away from the midline. Inversion can be done 30 degrees and aversion can be done 20 degrees only. So I have finally completed the anatomical position, planes and terms. These words will be very useful for you, so that you can go through the next topics very fastly, so that you could not have a break in that. These terms will be very useful in the entire anatomical positions, planes and terms. I have completed this, and I also need some suggestions from you. If anything need to be improved in this, let me know in the comment section. And thank you, and I'll come in the next video. Bye bye, see you.